When your dog has cancer, the words you want to hear after you go through a treatment process is, it's gone, it's cured, your dog's in remission. First of all, how likely are you to hear that, and what are the different types of remission? We'll start with you first, Dr. Ettinger in New York.
So if you're with remission, usually what the oncologist is referring to is that there's no detectable cancer based on the test that they're doing, whether it is feeling the lymph nodes for a lymphoma patient or doing a fine needle aspirate of the lymph nodes, or for maybe hemangiosarcoma, they did chest x-rays and an ultrasound and there's no detectable evidence of those cancer elsewhere in the body. Then you'll hear the term remission. I think the ones where lymphoma, which is one of the more common malignant cancers in dogs that I treat, you'll hear sort of levels of remission. Complete remission, meaning the cancer is no longer clinically detectable, partial remission, stable disease, and then, the frustrating one to hear is progressive disease, is that the cancer is on the move or getting bigger or not responding to treatment as we would like it to.
Dr. Dressler, how often do you get to say that your dog's cured or we got remission?
I think it depends on the definition of the word cancer, because usually when we think of cancer, we think of quote unquote systemic malignancies. And a systemic means it's involved in a system or the whole body, it's spread. And a malignancy means it's aggressive, progressive, and does not stop, dangerous. However, there are growths that are cancerous growths that can actually be cured in veterinary medicine. Those are usually localized. In other words, they can be removed with surgery. Therefore, with those growths, we do a certain surgery. Usually we do a wide margin, meaning we take out a lot of normal appearing tissue around the growth, and we can occasionally get actual cures even with true malignancy. So it's important to remember the type of cancer that we're talking about and what our expectations are with this particular type of cancer.
Dr. Ettinger, how often do you see remission with the patients that you treat?
I think it really varies with the different types of cancer. Again, for lymphoma, the average remission for a dog is over a year. It's about 13 or 14 months with a good chemotherapy protocol. And if you remember that most dogs, have a shorter lifespan, sadly, than people, that can be a really good extension of their life, and they feel really well and live well during that time. So again, we don't want our pets just to live longer with treatment. We want them to really live well. So, and I think that's a hard thing for most guardians to sort of wrap their head around when they first come in and they start listening to statistics and numbers. We all want our pets to live, many, many, many years, but their lifespan is shorter, and you have to compare how long the remission rate is to no treatment, and then put that into perspective to the anticipated, length of your dog's life. So, again, I think, remission is it's variable, and it depends on the cancer, and again, no treatment versus the treatment itself.
Dr. Ettinger, Dr. Dressler, thank you so much. There's a lot more information in the Dog Cancer Survival Guide. Thanks for joining us.
Thank you.
Thank you.